Right, hello, Herbets and Sherbets. My name's Danny Whitaker. This is My Own Worst Enemy, mental health podcast. First things first, please allow me to apologise. It's been a very unproductive month. I think it's been about 4 or 5 weeks since we last posted an episode. I bet you lot have been chomping at the bit for some new material. If you have, you've been quiet about it. I'll be honest, I've not had any emails. No one showing any concern or anything. But I'll take that as me having a very patient audience. Not that I've got no audience. But I have an excuse. I've had a baby. Well, I haven't. My other half, Leanne, she's had a baby. With me, it's mine. I mean, as far as I know. I've not had a DNA test. I should probably get on that. But yeah, that's what we've been doing. I've already got a little boy called Roman. He's 6. And now we've added a girl to the troop. She's called Hope. A name which is very much influenced by my journey over the past couple of years. She had a bit of a shaky start in life, so she kind of stopped breathing a couple of hours after she was born. Then she was in ICU for a few days. Then we took her home, and then she was back in hospital again. And yeah, but she's fine now. She's home. She's getting fat like babies are supposed to, keeping us awake, driving us insane. I won't go on about it. Babies are only interesting to the people that have had them. No one else cares. Loads of people have babies. Nothing special about it. But yeah, that's my excuse for being so unproductive these past few weeks. Anyway, today's episode, we're here to discuss the topic of alcohol abuse and addiction and its relationship to mental health. My guest today is Matt Field. He is Professor of Psychology at the University of Liverpool, where he heads up the Addiction Research Group, investigating the cognitive, biological and social processes involved in addiction, with a focus on problem drinking and cigarette smoking. He is co-author of Essential Abnormal and Clinical Psychology and a regular contributor to the Mental Health blog and other online resources on the topic of addiction. In 2009, he was the recipient of the British Psychological Society Spearman Medal, and since 2014, he's been an advisor for Alcohol Concerns' Dry January campaign. So, despite being a little bit shorter than most of the other episodes we've done so far, we cram loads of stuff in. The show notes on this one are probably more extensive than any of the other episodes we've done so far. So, we discuss things like the difference between alcohol abuse and alcohol addiction. Does alcohol addiction run in families, and who is most susceptible? We discuss something called the alcohol paradox. That is why people in deprived communities have higher levels of alcohol-related ill health than people in non-deprived communities, despite drinking the same amounts of alcohol. We discover why stopping drinking is only half the battle in overcoming alcohol addiction, what you can do as a friend or relative to help somebody with a drinking problem, what the government could but seemingly won't do to help reduce the amount of alcohol-related harm, and finally, we tackle what is possibly the most controversial question of all, whether or not alcohol addiction is a brain disease or a disorder of choice. You can follow Matt on Twitter. He's at field_Matt. So if you enjoy this episode, get anything from it, be sure to give him a shout, say thank you there. Anyway, I'm off to get some much needed sleep. Without further ado, please enjoy my conversation with Professor Matt Field. Okay, Matt Field, welcome to the podcast.
Hi.
Today's topic is alcoholism, alcohol addiction. The first clue as to what we're going to be discussing is right there in that introduction. But before we get into the actual, those aspects of it, I'd like to find out a little bit about you, if that's okay. Also, I think I might have contacted you through Sam Cartwright-Hatton. Is that correct?
Yes, we've written a book together.
Right, okay. So, yeah, I was going to ask, so how do you guys know each other and stuff? Because you both study at the moment, studying 2 completely different fields. So
we have a mutual friend at Sussex, University of Sussex, where Sam still is. But I did my PhD at Sussex, so I know Sam from there. And we ended up writing a textbook together.
Okay, perfect time for a plug if you want to mention what that textbook is.
As far as I know, the textbook's kind of sunk without trace, and it hasn't sold very many copies. So, anyway. But it's all right. I'm not bitter. It's not Sam's fault.
Well, hey, you never know. As this podcast grows, it might Might help you get that second edition printed.
Essential Abnormal and Clinical Psychology, and it's published by Sage in 2015.
Okay, well, I'll include it in the show notes anyway with an Amazon link. Okay, so yeah, on to you now with this particular topic. How did you come to study this? What was your interest in it? Is there any personal genesis of it? All those things.
The route into it for me was I was an undergraduate at Swansea, and I did my undergraduate project on alcohol consumption and mood, and I just found it really interesting. And from there, I went to do a PhD, and then I got a I did a PhD on alcohol and mainly tobacco, actually. Then I got a postdoc research position also looking at tobacco, and then I moved to Liverpool 13 years ago, initially as a lecturer, and I've just always been interested in addiction. So I've been interested since I was an undergraduate, and I've just kind of kept doing it because I find it interesting. So I really enjoy my job. I don't really have a kind of personal story behind it, although what I will say is studying addiction makes you very self-conscious about your own drinking.
Right, okay, yeah. Well, you see, when I first contacted you, I did want to kind of discuss addiction in a very general sense, but it's a massive topic, and I think things like smoking and drinking and substance abuse, they all kind of probably deserve their own episode at some point, which is why we're just...
Yeah, you could certainly justify them like that. Although, I mean, I've studied tobacco. I studied tobacco before I studied alcohol. I almost exclusively do alcohol now. I've also done some stuff on cannabis dependence. I would say there are many, many similarities between them, and certainly in our understanding of addiction, I really don't... Biological adaptations aside, I don't think they're really that different. I think addiction to gambling and addiction and tobacco and cannabis and heroin, I think there are more similarities than differences. But so I'm happy to answer general questions about addiction. But yes, you could. There will be some things which are quite different for certain drugs, and gambling as well. That you could certainly have interesting podcasts about all of them.
Well, you know what, actually, just kind of thrusts us straight into the thick of it, really, because during my research for this interview, it seemed to me that there was that I might, with this topic, I might be kind of pushing the boundaries of my remit as a mental health podcast, because even though there definitely seems to be some mental health related issues there, which we'll get to, there's also this idea of alcohol dependence as a disease, and there's also a very physical component to it. So, let's not jump around too much. I'd like to kind of cover that, actually. Yeah. So where does alcohol dependence...
Yeah, where does it sit?
Yeah, where does it sit within the realm of mental health?
So you've got the World Health Organization's diagnostic system called the International Classification of Diseases, and that puts alcohol and other addictions alongside other mental and behavioral problems. So it's clearly a mental problem. It's a psychological problem. And similarly, you've got the American Psychiatric Classification System called the Diagnostic and Statistical Manual of Mental Disorders, and it goes in there as well. So it's accepted as a psychological disorder. And of course, a psychological disorder, there can be overlap between psychological disorders and diseases. I mean, we can talk about, few people would disagree do we think schizophrenia is a disease?
Do you mean in an organic sense?
Yes.
Yeah,
so many people think schizophrenia is a disease in the organic sense. Others would differ.
Yeah.
But actually, it's probably not helpful to try and say there's psychological problems and then there's diseases, as in organic diseases, because there's the boundary between them is probably very blurred. So it's not helpful to make the distinction.
Right.
Something else that comes into it, though, which I wanted to talk about later, is that there's also an element in addiction. There's an element of choice and volition, which you don't see with other psychological disorders. So I don't know if you drink or smoke or use any substances, but if you do, there's an element of choice in there. And that element of choice, people are still exercising choice even when they're addicted. And so, but you wouldn't say that for many other diseases like depression or schizophrenia or bipolar disorder or anything, you wouldn't say that people chose to have those symptoms, if you see what I mean.
Yeah.
that's a bit of a difference in that there's an element of choice. So addiction is all things, really. It's a psychological disorder, but it's also drug use is a voluntary behaviour, and also it does involve adaptations of the brain, which I think could make it, which justify calling it a disease.
Right. Okay. So, right now, we're just touching upon the idea of boundaries there. Again, researching this seemed to be three specific kind of terms that I came across. There's alcohol abuse, alcohol dependence, and then alcohol addiction.
Yeah.
Are they all legitimately separate, and what would be a good description of each one of those?
So alcohol abuse, alcohol addiction and alcohol dependence, I don't know where you've read those, but alcohol addiction wouldn't be a recognized term, I don't think.
Okay.
But basically, it's useful to look at the history of this. So basically, the World Health Organization classification system makes the distinction between alcohol abuse and alcohol dependence. So according to that classification system, abuse is drinking at levels which are likely to be harmful to your health if they're not already. But you might not necessarily have the symptoms of dependence, which are largely things like tolerance and a withdrawal syndrome, and also the kind of psychological aspects like a real difficulty at stopping. So abuse is harming yourself without necessarily the physical adaptations and the inability to stop. Now, the World Health Organization are going to revise their classification system very soon, and there's quite a lot of suggestion that they're going to abolish this distinction. Now, one of the reasons why they're probably going to do that is because the American Psychiatric Association, who make the other classification system called the Diagnostic and Statistical Manual of Mental Disorders, they also used to make the distinction between abuse and dependence. But when they revised their manual in 2013, they abolished the distinction. So now in the DSM, you only have a category called alcohol use disorder, and that's basically on a continuum. So you can be at the low end of the continuum. What that means is you're drinking at a level that's probably going to be harmful to your health, but you might not necessarily be what we might think of as dependent. You might not necessarily have a withdrawal syndrome if you stop. You might be able to stop drinking if you want to. But then at the extreme end, you've got people who you think of as your classic alcoholics, people who would have a withdrawal syndrome if they stop drinking, are really unable to stop, and the people who need urgent help. So,
do you think that was the right move to bring them into the same category?
I do, and the American Psychiatric Association took a long time consulting on this, and there was always going to be a controversial decision, because what is in effect saying is that there's no qualitative difference between someone who's severely alcoholic and someone who just drinks a bit too much and is probably drinking too much, like many people do in the UK, drinking a bit too much, and it's not good for their health. The modification, this change in the way we diagnose alcohol problems suggests that there is a difference, but it's only a difference on a continuum. There's no point at which you switch from being an alcohol abuser to someone who's alcohol dependent. Now, we'll have to wait and see what the World Health Organization do, but most people were in agreement that what the American Psychiatric Association did was it followed a very kind of a rigorous review of the evidence, and most people thought it was, on balance, was the most appropriate thing to do. But there are still people who disagree and think that alcohol dependence, alcoholism, is something very different from drinking too much that might harm us, and people are divided on it.
Yeah, and another thing, even though we've kind of already covered this. One thing that's said about what term should I be using throughout this interview now?
Alcohol use disorder is the technical term, which is probably that covers everything.
Yeah.
And then alcohol dependence, if you're talking about what you would think of as an alcoholic.
Right. I'll stick with alcohol dependence. I know that one. I'll be tripping all over the place trying to remember the other one.
That's all right. No, it's all right. Yeah.
Yeah. So a common thing you hear people say is that alcohol dependence is a disease as well. Is it a disease? What is a disease? And are people right to say that? Because again, that brings us back to what you were talking about before, about this idea of volition.
Yeah. So this is a really interesting subject, and one that I'm thinking a lot about at the moment. But what we know is that, so for example, some people, addiction's partly heritable. So there's a addiction runs in families. The heritability is relatively high. Not as high as something like schizophrenia, but it seems to be higher than something like anxiety or depression. So that might suggest that there's some heritable risk for brain development which predisposes you to addiction, possibly. The other thing to note is that if you take a lot of drugs for a long period of time, then your brain will change, and we can see that the brains of people with addiction are different from people without addiction. So you might put those two things together and say, yes, that means addiction is a disease. In the absence of any other kind of disease is a very difficult thing to define, and certainly in the USA, there's the very dominant view is that addiction is a brain disease. It's an acquired disease of the brain. There's a heritable vulnerability to it, but once you get it, your brain changes, and then it's very difficult to undo those changes. So we call this. It's really not one theory; it's a class of theories, but we call this the brain disease model, and that's completely dominant in the USA, and it's not quite so dominant, but almost as much in the UK. Now, there's some resistance to this because there are many implications to the brain disease model, and one of them is that there may well be the ultimate cure for addiction might well prove to be a biological one, like treatment, like drug treatment or surgery. And the other one is that people are unlikely to kind of change by themselves, if you see what I mean. But there are some people argue that kind of medicalizes a problem which can need medical intervention. Like people might need medical intervention to, say, get over the worst of the withdrawal syndrome. But actually, perhaps the solution to it might be, perhaps you're kind of by selling people the disease model, you might be robbing them of their own ability to exert control over their behavior. So is it a disease? Maybe. A really interesting observation from a guy in Canada called Mark Lewis is he's written a couple of books on the brain disease model, and his observation is that we look at how the brain changes in addiction, and this might suggest that drugs are toxic to the brain and they permanently change how it works. But another way of looking at that evidence is that whenever we repeat an activity that's very pleasurable, inevitably our brains change. So our brains change in response to every experience that we have. There's classic studies showing that the hippocampus, a part of your brain involved in kind of spatial memory, that increases in size in taxi drivers. Now, it doesn't mean that people who are born with a big hippocampus are drawn to be taxi drivers. Right. The more likely implication is that the brain adapts because they need good spatial awareness. Well, less so now, technology. So there's lots of examples of how experience changes the brain. And Mark Lewis's argument is that experience changes the brain, and that can basically explain how repeated experience of taking drugs might well lead to permanent changes in the brain. But that's what we'd expect if you repeat anything, and that doesn't necessarily mean it's a brain disease.
Right. Okay. So not a simple black and white answer then.
No, there's lots of disagreement about it, and many people would say, well, it clearly is a brain disease, and you can point to lots of adaptations or changes in the brain that occur in people with addiction. But there are also criticisms of this approach, which kind of don't deny that these changes exist, but suggest that maybe that doesn't mean that that's where the solution can be found.
Right. Okay. Yeah. That's the longest it's taken to define. No. It's great. What I like about it is it shows the complexity of the issue, and like I say, because I'm pushing the boundaries of my remit here with this particular topic. So the next thing I'd like to move on to is the who. So we know what we're dealing with now. So who are the people that are susceptible to alcohol dependence? All the basic epidemiology, really. So the gender differences, things like age of onset, and maybe if you know anything about different the disparity between different cultures.
In the UK, about 9 million people drink more than the government guidelines. So the government guidelines at the moment are men and women should drink no more than 14 units of alcohol per week. So that's about 1.5 bottles of wine over a week. And about 9 million adults in the UK drink over that. So it's quite, not a tiny minority of those are going to be dependent. Most of them Most of them are okay, but that means they're drinking at a level that is likely to be harmful to their health, although how harmful is a matter of some debate. But we know, so about 9 million in the UK drink above the guidelines. In terms of prevalence in the UK, well, about 4% of women and about 9% of men who drink alcohol are likely to meet the criteria for alcohol dependence.
Wow.
So that's quite high, but bear in mind that those criteria have kind of shifted downwards over the years. So that doesn't mean, and this is kind of, we also know that of people with alcohol dependence, only about 1% will ever receive treatment.
Right.
So people that we see in treatment services are just really the tip of the iceberg. It's much more common than people think. Most people won't get any treatment, and actually there's good reason to believe that most people will recover without any intervention whatsoever. So there's a school of thought that a lot of people will mature out of it at some point.
All right. Well, that's a perfect kind of perfect segue into the next thing is, what are the age ranges? And think about the age of it tends to become a thing.
So most people who seek treatment won't pop up in treatment services until they're in their 40s or 50s. But it's thought that the kind of the problem drinking will often have been going on for sort of 10 or 20 years before people pop up in treatment. So there's a kind of standard. There's a fairly there's a trajectory of drinking in the UK. So people kind of start drinking when they're in their mid to late adolescence, and then most of the time you see some kind of leveling off in the early 20s, and then it starts to decline by about the mid to late 20s. And this is kind of perfectly tallies up with when people get proper jobs, have a family, etc. All these changing life roles. But then what we see is that a considerable minority of people don't kind of mature out, and it's really those that kind of keep drinking through. Many of those are people who kind of don't mature out of alcohol consumption in their kind of mid to late 20s, might well go on to develop an alcohol problem. So it's hard to say when it actually starts, because it takes a really long time to become dependent, really. You have to drink at high levels for a long time. But generally, people in treatment, you see them in the average age would be kind of mid-40s.
Right, okay.
But that doesn't mean they've been dependent. They just woke up one morning and dependent. It's been a slow burner,
Right. And what about maybe kind of, is there any kind of correlation with class and like religion, ethnicity, things like that as well?
So ethnicity. So in the UK, alcohol problems are less common in people Muslims for whom alcohol is not generally accepted. But what we do see in ethnicities in which alcohol is less a part of the culture is that if people do drink, they're more likely to have a problem. Mm-hmm. Whereas for Christian people, and the majority atheist people in Britain, it's more done by everyone. You see what I mean? But in other cultures, for which alcohol isn't such a big thing, then if you drink, you're more likely to have a problem. I've said there's a gender difference in alcohol dependence. So like the severe end is more common in men than in women. In terms of class, it's quite interesting. We talk about the alcohol harm, something called the alcohol harm paradox. Now, this refers to the observation that basically people who are of higher socioeconomic status tend to drink more alcohol than people of lower socioeconomic status. But the more we see more alcohol-related harm, so things like hospital admissions, liver disease, that kind of thing, we see more alcohol-related harm in people of lower socioeconomic status. So the segment of population that drink the most don't necessarily suffer the most alcohol-related harm. And there are various explanations for that, but one of them is that there are other behaviours which might go alongside alcohol consumption, like bad diet, smoking, lack of exercise, and those things might be more common they might vary by socioeconomic status as well. And there's also kind of like access to medical help and willingness to seek it. But yeah, it's very kind of well defined, this alcohol harm paradox that wealthier people tend to drink more, but they're less likely to suffer the harm, which is unfair.
Yeah, interesting. Wow. Okay, so now we're kind of definitely getting into my realm here. I've got this heading in my questions here of causes. Now, I'm imagining, even though you just said then it tends to be a bit of a slow burner, it's something that accumulates over time.
Yeah.
But I always imagined that alcohol comes as people use it as like medicinally. They use it to ease the pain, would be a cliche, and to forget things and to relax because they're stressed out and things like that.
Yeah.
And so, is it true that there's always a kind of an underlying cause, an underlying catalyst that would be some sort of mental health issue? And if so, what are the main causes in that sense?
So I think the consensus is that there's certainly something like experiencing sexual abuse as a child is a massive risk factor for the development of all kinds of addictions in later life. So that massively inflates the risk. But as you probably know from talking to other people about other psychological problems, severe trauma as a child increases your risk of pretty much everything.
Yeah.
There is also evidence that a big negative change a big negative life change at any point in your life increases the risk of addiction to alcohol and other drugs. Things like divorce, death of a close family member, all of these things. And we also know that people who have kind of high pressure jobs tend to drink too much and are more at risk of developing alcohol addiction, etc. So all of these things definitely can predispose people to developing alcohol problems. However, it can be a bit of a red herring because people can develop addiction even when none of those risk factors are present. You see what I mean? It can happen anyway. It can happen to anyone, even if their life is pretty rosy. So those risk factors are important, but they're not. What's the word? They're not inevitably the cause of addiction.
Right.
The main cause of addiction is taking a lot of drugs for a long period of time.
Right.
Yes. I'm sorry to be talking, but the point is that regardless of risk factors, if you drink alcohol for a long period of time, if you do it regularly and do it over a long period of time, you almost certainly will develop alcohol dependence. Whereas other things like your heritable risk, other lifestyle factors will all kind of moderate that risk. But
Yeah. Do you think it tends to be that people have maybe already been drinking for a while? It's something they're already into, and then there is some sort of life event which maybe ups the ante a little bit, as opposed to this idea of someone has just, maybe someone has just been a casual drinker since forever, and then one day something terrible happens. They go home and they hit the whiskey bottle, and then they never come off it. Is it more
so
like
you're talking about you're saying there are two different possibilities there, or?
Well, just because I suppose this word that I've used there, causes, the causes of it, it's probably not the right word to be using. As you've just said, then the cause of addiction is to be using substances for a long period of time. So I suppose I was like with something like PTSD. There's a causal event that you can pinpoint
very clearly.
But it doesn't.
But then again, not everyone who's exposed to a traumatic event develops PTSD.
No.
The stressful event is not enough to cause PTSD. There's some other factors are involved. I don't know if you covered it in your podcast yet, but the way you are before the traumatic event and what happens to you soon after the traumatic event have a big influence on whether you'll develop PTSD or not.
Yeah. So I guess what I was fishing for was whether the traumatic events are a catalyst for beginning those sort of behaviours, or whether there's something that just increase already established behaviours.
Yes. So you can find instances where exposure to trauma and addiction are dissociated. So you can find instances where people experience something very unpleasant, like let's say divorce, and they might start drinking a lot in the interim, but they might well stop as well. They might not necessarily, it's not inevitable that they'll develop an alcohol problem. Yeah. And equally, there are instances where people have developed, you can look at people have developed alcohol problems over time, but there's no obvious negative life event which has triggered it. So it's obviously, so those are two extremes, but of course the your risk of developing an alcohol problem greatly increases if you experience a stressful life event. Yeah. But it doesn't mean that there's not a one-to-one correspondence.
Yeah, like you were saying, people can have a perfectly fine life and still end up addicted to alcohol. Would that be would that be because, I suppose, the kind of bro science-y idea of any kind of addiction is that the more you do it, the longer you do it for, then you have to up the ante every time to get the same buzz. And so,
quite possibly, that's what I mean. It could really be as simple as that. So, the longer you do it, the more likely you are to. I mean, and there's very clear evidence that the longer you've been drinking, the greater your risk of developing alcohol dependence in the future is, and that is perfectly moderated by the age at which you start drinking. Something I wanted to come on to. So if you can imagine, there's a perfect linear relationship between the number of years you've been drinking regularly and your risk of dependence in the future. But that curve, that line, is much steeper if you start drinking younger. So if you start drinking alcohol when you're 13 years old, and if you're still drinking 20 years later, there's a pretty high likelihood you'll be dependent on alcohol. Whereas if you start drinking alcohol when you're 18 years old and you're still drinking 20 years later, that likelihood is much reduced. So the age at which you start seems to have a big influence on whether you will become dependent or not. So this might partly be why like traumatic life events, it don't necessarily lead to the development of addiction.
Right.
You know.
So, yeah, one question I've got here is there certain characteristics, certain personality traits that makes some people that separates those who drink and are fine and it never becomes a problem, and those who it eventually does become a problem? And the kind of inspiration for this question is this idea of an addictive personality. Yeah. People claim to have addictive personalities.
Yeah. So there are a couple of traits which are really interesting. So one of them that we've studied a bit is impulsivity. So this kind of tendency to think only in the here and now and discount the future, and this tendency to be a bit slow to inhibit your behavior. Now that is interesting because we know that people who are more impulsive are more likely to be addicted in the future. So we know that there's a cross-sectional association. So people who are addicted tend to be more impulsive than people who aren't. But that doesn't tell us what's the chicken and what's the egg. It doesn't tell us if impulsive people would more likely to become addicted, or if taking lots of drugs makes you more impulsive. So there's good evidence that actually it works both ways. But there's particularly good evidence that people who are like adolescents who are highly impulsive are more likely to be drinking more in the future. There's also really nice evidence that people who've got a positive family history for alcoholism or other addictions, they tend to be more impulsive. So if you've got an alcoholic parent or two alcoholic parents or an alcoholic sibling, then you tend to be more impulsive than another person who doesn't have that family history, which is really interesting. It suggests that this is a characteristic, which is kind of that's a characteristic that's there before people even start using drugs. The other thing, there's other things kind of all round bound up with that, things like something called sensation seeking and risk taking. So the urge to seek out new and pleasurable sensations, the individual differences in taking risks. These things all kind of have a plausible relationship with addiction, and indeed we see that people who are higher on sensation seeking and risk taking, they're more likely to become addicted in the future. And then so those are kind of addictive personality traits, if you like. And then there are a couple of other really interesting things which are perhaps more specific to alcohol. So one of them is the low level of response. So we know that children of alcoholics, people with a family history, when they drink alcohol, they have a diminished response to alcohol, so it doesn't affect them as much. And that we see that in. So this is just, if you just look at children of alcoholics when they have their first drink, they're much more, they have a kind of this innate tolerance to alcohol. So one idea is that maybe why there's a heritable risk for alcoholism is because you have to drink more to get the same buzz as all your friends are getting. And if you have to drink more, you're more likely to become dependent on it. And then there are various other heritable things, such as there are certain enzymes involved in the metabolism of alcohol, and if the degree to which you have this balance of enzymes determines whether you can flush alcohol out of your system quickly or whether it builds up and makes you feel ill. And heritable, that balance of enzymes is heritable. And we know that in certain cultures, like in East Asia, the balance of enzymes in those cultures means that if they drink a lot of alcohol quickly, they get sick. And that's probably why the prevalence of alcohol dependence is lower in those countries. So there's all kinds of things, some more biological, some more psychological, which make someone more vulnerable or less vulnerable to alcohol addiction.
Wow, so there's like an evolutionary adaptation there that's taken place.
Well, it's hard to know how it's developed, and I don't really want to get into that, but yes, there's a lot of genetic variation in that, and who knows why it's developed. But some people are born more capable of processing alcohol, and others are more kind of sensitive to it.
I don't know if this is a bit of an elementary question, but do we know why some people enjoy alcohol and other people just don't? Because surely the sensation is the same. It's the same chemical, the same things going on chemically in your body. I'm one of those people. Like I don't like the sensation of it. But then some people love it.
Yeah. Well, the thing is that it could be that there's just the sensations might not be the same because there's so many. Because alcohol, you obviously you ingest it. It's processed by the liver, and then eventually it gets into the bloodstream and gets into the brain. There's so many stages of that process where there might be individual differences. The alcohol works because it's an agonist of a neurotransmitter called GABA, and there are individual differences in the kind of the number of these receptors and their density. So there could be individual differences in the way that our livers process it, in the way that it passes through the gut, in the way that our brains process it. So that it could be simply down to these biological differences, and equally it could be that even if the kind of biological response, so like the way the brain responds to alcohol was the same across people, there could be many reasons why some people might like the effect and others don't. It could be cultural as well, which is in the UK we kind of value it's socially acceptable really to talk rubbish and be a bit disinhibited when you've had a few drinks, whereas in other cultures it isn't. So that's probably has something to do with it.
When you ask the question to people that are alcohol dependent, why do you do it? What do you get out of it? Is there tend to be a common answer to that? Of why it's maintained?
It depends really. I mean, for many people who consume alcohol, they perceive it as a rational behaviour, and they're probably right. They enjoy the effect it has. It's a social glue, and if they drink more than the guidelines, if they're aware of the guidelines and they drink more than them, then they probably will say, well, it's just a risk I'm happy to take. You take risks in your life all the time. You take a risk every time you have a bacon sandwich. But it's so people have very valid reasons for drinking. When you see people in treatment, they often the stereotype is that they claim to not really particularly enjoy the effects of alcohol anymore, but it's better than the alternative. So the example which I use in my teaching is that if someone's homeless and the life has gone wrong for them, then it's they might not particularly enjoy being drunk all the time, but if they stop drinking, they're still going to be homeless and not have anything. They're just not going to have they're not going to have the relief of alcohol. You see what I mean? But so it's not that they enjoy it. It's just that an alcohol-free life is even less enjoyable. If that makes sense.
Yeah.
And so there's actually a lot of kind of the way that we think about, a lot of the way that psychologists and psychiatrists think about addiction is exactly that. In that it doesn't hold alcohol when you become addicted. Alcohol doesn't hold any particular appeal, but it holds more appeal than not drinking. It holds more appeal than nothing's particularly attractive. But the least attractive option is not drinking at all. Does that make sense?
Yeah, and that certainly brings it in again. The mental health aspect of it is that idea of kind of facing the world sober is not a nice idea. So when we're talking about somebody that's alcohol dependent, are they drinking all day, every day, or can it be just a once a week thing? What is there a pattern there that needs to be kind of established to say, well,
I don't think you could really say that drinking above a certain amount would make you dependent. Now, there are some researchers, and so there is an element of truth in this, that we can just cut through all of this ambiguity about what labels should we use. We could just measure consumption, and total consumption is very highly correlated with the severity of the alcohol problem. But but everyone's different. You can be alcohol dependent without drinking every day. But then you can have someone who has a couple of beers every day, but they might not show any. They might not really. They'd be, if you have a couple of beers every day, you're going to be over the threshold, the UK government guidelines, but you might not have any evidence of it harms. Whereas someone else might drink 3 or 4 days a week, but their relationship to alcohol, so their inability to stop drinking, that might kind of make them dependent and someone who drinks every day, but perhaps at a lower level might not be. So there's no fixed amount which makes someone dependent or not. But if you look at what the diagnostic criteria are like, they're pretty clear, basically.
So, but that idea of, that kind of typical image of the alcoholic as somebody who's down and out, doesn't take care of themselves and just kind of sits in bed all day drinking. That's a false image.
That's probably very misleading. And most people with alcohol dependence would not look like that.
Right.
You'd have many people many people are still much more highly functioning than that, but they'd be clearly like quite highly alcohol dependent.
Right. What are some of the physical consequences of prolonged drinking, and then and also some of the social and familial consequences as well?
Yeah. So in terms of, I'll answer the second bit first. So basically, all of the diagnostic criteria, they have many different they have a list of features, behavioural features, which suggests that someone's alcohol dependent. But really what they all amount to is what we call a narrowing of the behavioural repertoire. And what that means is alcohol just becomes more and more important to you, and everything else becomes less and less important. So you'll find that, people will, the first thing they think about in the morning is when are they going to be able to have a drink? And they're kind of preoccupied with when they're going to be able to drink, and they become less interested in other things which should know, like how their kids are doing in social relationships, etc. You find that social relationships are kind of become dominated by drinking relationships, that kind of thing. So you really see this narrowing of interests, such that you don't become interested in anything else other than drinking or drug use in the other case. In terms of physical consequences, well, it's one of the biggest contributors to premature death in alcohol consumption is in general, in worldwide, but particularly in Western countries, kind of less so in the Middle East. In countries where predominantly Muslim people, so alcohol is not such a big part of society. So it's a big cause of preventable death, and that it does that through various things, including things like liver disease, like fatty liver, and then cirrhosis of the liver, hepatitis, but also cardiovascular disease, and various cancers. So the change to the government guidelines in January 2016, one of the main kind of planks of that, one of the main bits of evidence that they summarised, which a lot of people didn't know, is that alcohol increases your risk of a number of different cancers, and it does that at very low levels. So alcohol kills a lot of people, and we might tend to think about liver disease. Liver disease is a growing problem in this country, but it's various things, like it's contributed to high blood pressure, cardiovascular disease, and also cancers.
When you were talking about, like, from a social standpoint and the way people are with the families and stuff,
mm-hmm.
Are they? Do people tend to establish certain behaviours that enable to, like, what's the question I'm looking for here? Are they good? Are people that are alcohol dependent, are they good at hiding it from people? So when you say you've got someone that might have a job and a family, etc. Yeah. But they still.
I don't know too much about this, but what I do know is that one of the kind of criteria for diagnosis of an alcohol problem is going to great lengths to conceal how much you're drinking from other people.
Yeah.
And yeah, I mean, it's the stereotype, isn't it, of people keeping a bottle of whiskey in the desk drawer, etc., etc. People hiding the recycling. But I don't. I know that it's one of the features that you use to diagnose it. If people are not being very honest about their alcohol consumption, it suggests that there's a problem.
Yeah. Is there also any truth to this idea that not engaging in that behaviour would expose them as being alcohol dependent, in the sense that you hear sometimes people saying that you need the alcohol just to function.
Mm-hmm.
And so it's actually drinking the alcohol that enables them to act normal around people. Is that?
Yeah. Well, people certainly get to the stage where they believe that's the case. Yes. But then when you look at people who have managed to come off alcohol and have been abstinent for a while, then they'll often report they'll often say that they realise that at the time that was what they believed, but subsequently, now that they're abstinent, they see that wasn't the case, and actually life is much better now that they've abstained. Yeah.
Right, that brings us nicely onto like treatment options. So I guess my first question is, so somebody's at the point where they're alcohol dependent, and not drinking is they need drink to function. Let's say they're at this point. What is their first port of call? So
it really depends how severe the problem is. So we kind of have graded interventions, really. Something's called a brief intervention is just kind of a chat with the doctor, or it might even be like a dentist or a pharmacist, and that might be just simply measuring how much you drink, and sometimes perhaps comparing that with people of your age and gender. That can be enough to kind of prompt people to think, oh yeah, maybe I am drinking a bit too much. So at one level, when you go to your GP and they ask you how much do you drink, and then you tell them, and then they tot it up and they say, have you ever thought about reducing? You should think about reducing how much you drink. That's a brief intervention, and that works for quite a lot of people. That kind of just getting people to. A lot of the problem is people aren't really aware that what they're drinking is harming their health. But really, you're talking about people who are a bit further down the line.
Yeah.
And basically, if you ended up being referred to an alcohol treatment service, they'd first assess you to see if you needed to be detoxified. So what this means is, alcohol withdrawal can be very dangerous. So if you withdraw from alcohol, if you're very severely dependent and you stop drinking, the withdrawal syndrome, which can include things like convulsions, that withdrawal syndrome can be fatal in extreme cases. So it does need to be medically managed, and that's what detoxification means. Detox just means you're given a drug which effectively keeps the withdrawal symptoms at bay. You're just basically given Valium and some anti-epileptic drugs, and these stop you having these seizures until you're kind of over the worst of it. But detoxification is really, that's for people who are very severely physically dependent, so who have this strong withdrawal syndrome. But then that's not a treatment in itself. And when I talk to people who work in treatment, this is a common problem that they see. They say they see the same people over and over again coming for detox, because people believe that detox is what you need to recover. But detox is really the first step. What many people after detox, what's really important is that people get some kind of intervention to prevent them from returning to their former patterns of behaviour. And for many people who get treatment for an alcohol problem, they won't need detox. They won't be that severely physically dependent. So they can go straight into some kind of psychological therapy. And in the UK, the things with the best evidence base behind them are things like cognitive behaviour therapy, which is kind of teaching people to be aware of the triggers for drinking and teaching them to kind of deal with those triggers and find alternative behaviours to replace them. There's motivational interviewing, which is a kind of a directed counselling technique, which the aim of this is to make people, when people come for treatment, they're often, they might say, well, I really want to reduce drinking because it's affecting my relationship with my kids and my wife or whatever. I want to reduce drinking, but they're not stupid. They're drinking for a reason. They're drinking because they like it in many cases, or they're drinking because they think they need it. And what motivational interviewing does is it really tries to make people aware of this conflict, this ambivalence that they're feeling, ambivalence towards alcohol, the sense that I need it and I want it, but at the same time it's killing me and it's ruining my life. Make people aware of that so that with enough So it's more than just counselling, and it's more than listening. It's more about directing people to be motivated to change the behaviour themselves. So that works. And then there's also things like family therapy and couples therapy. You need the support of close others to help. And then as an aside from that, we have these self-help groups, the most well-known of which would be Alcoholics Anonymous,
yes,
which provide kind of a social support. So these are completely outside of anything the NHS might provide. So these provide, if you go to an AA meeting, you'll be paired up with a sponsor who's someone who was alcohol dependent, well, and still is, but has been abstinent for a long time. And that gives you kind of the social support for an alcohol-free life. And quite often people who are alcohol dependent might get some kind of treatment from the NHS, be it detox or some kind of psychological therapy. And then they'll often join an AA group as well.
What do you think of this idea of alcohol dependence being chronic, in the sense that once you've become alcohol dependent, and even if you go through a treatment program, and you've been teetotal for 6 months, a year, that you're always an alcoholic? Is that true? Can people ever go back to just social drinking? Is it ever safe?
So it's interesting. So if you kind of go along with the brain disease model, and the idea would be that once you're addicted, your brain's changed forever, and the only way you can kind of manage the brain disease is by never drinking again. Equally, Alcoholics Anonymous is very clear that the only path to recovery is complete abstinence. And for many people who perhaps aren't so severely dependent, don't get on well with alcohol, they stop going to AA meetings because they think the thought of never drinking again is just, they think I could probably have a drink, I could probably drink occasionally. And it's true that there are many kind of treatments for, I wouldn't like to say how many, but many people who treat addiction don't think that abstinence is the only goal. And in fact, for some people, you have to treat it on a case-by-case basis. But for some people, it's reasonable to assume that they could go back to what we call controlled drinking. So drinking occasionally. But it really depends on the individual. But it's really a clash of kind of philosophies about addiction there. So some people, clinicians I work with here, think that it's possible for some people, and that, okay, you might give them some motivational interviewing to try and get them to really make a big lifestyle change, but it's probably good to aim for abstinence in the short term at least, but then in the longer term you might be able to go back to drinking occasionally. So nobody really agrees on what's feasible, but there's certainly evidence that a percentage of people who are alcohol dependent can drink socially afterwards, but there's also evidence that people who are severely dependent, as soon as they have a drink, so the Alcoholics Anonymous motto is not motto, but it's one drink makes a drunk. So the idea that if you just have one drink, fall off the wagon. So it's probably, the reality is probably that some people probably shouldn't drink ever again, whereas for others it might be okay. And you might never find out which you are until you try it, which might not be a good recommendation.
So what's the prognosis for somebody that's alcohol dependent in the long term? Like, do we know what the recovery rates are, what they tend to be? And
so there's some debate about this. It's viewed as a kind of a chronic brain disease by most people. But it is one that people can recover from with help. But then there's this interesting line of epidemiological research, which tracked people over time in the USA. And what it found, the way that this evidence is interpreted, is that there are so many people out there who were at one point met the criteria for alcohol or other substance dependence and who are now substance free. And that, in fact, that this is the majority, that most people, put it another way, this epidemiological evidence suggests that most people, the vast majority of people who ever met the criteria, who ever had a substance use disorder or an alcohol problem, alcohol use disorder, most of those people are now don't have that diagnosis. So that evidence suggests that people do recover. And if you talk to clinicians, they'll say, on the one hand, they do keep seeing the same clients over and over, keep going through these cycles of rehab. But equally, there is, and the reason we think it's kind of often the portrayal is that prognosis is really bad is because people do relapse. Very few people get treated and then are abstinent in the long term. But we do see that if you look over a much longer period of time, the prognosis is much better. People do recover. So people are torn on this. And it's all, again, bound up with this idea of, is it a brain disease or is it something you can overcome? So,
do we know why people the people that do relapse over and over and over again?
Yeah.
Is there any sort of pattern with those particular people?
Yeah, there is. And it's about kind of going back to the old life and hanging out with the same people that you did before. You need to make you need a bigger change in your life. Yeah. Than just dropping alcohol. Because if you're still hanging out with the same people who are doing the same things, it's really difficult.
God, it's true. That's a tricky one, though, that, isn't it? I mean, it's one thing to just to change your behaviour and stop drinking, but to change your social life and possibly your job and the people that's huge.
And if you become really entrenched, if your drinking's become really entrenched, then the only people you socialise with are your drinking buddies.
Yeah.
Your local, the places you go locally are places you go to drink. So it's very difficult to stop that. And that's perhaps why this epidemiological evidence suggests that perhaps what happens is that people undergo life changes, like they move to a new area or they have kids. And all of these life changes mean that the whole environment changes. So I've got a child now and I'm still living where I was before, but my life has changed completely, and it's so context can mean something like that, and you see this quite a lot, that kind of major life changes are associated with a kind of a fairly abrupt cessation of addiction.
And is there anything places like Alcoholics Anonymous can do to help people like that, or is that just a case of pure willpower?
Well, you can argue that that's exactly what AA does, because what happens is if you join AA, you immediately acquire a social group of people for whom alcohol is not a part of it at all. So you acquire a social group that do things that do not revolve around alcohol, and in this country that's quite rare. So that's one of the arguments why Alcoholics Anonymous is useful for many people, because of this kind of social support. It might not be the kind of underlying, like the 12 steps and the focus on abstinence. Those things might not be as important as the fact that you acquire a social group of abstainers and you can do non-alcohol related things with them.
Right, and I'd be a bit remiss if I missed this question out, because it was requested of me. The original question was what can friends and relatives do to help an alcohol dependent person? The original question was somebody that doesn't even want to seek help. Has that got an answer? I'm suspecting it hasn't really. If someone doesn't want to seek help, but just in general, what if you've got someone like that in your life, what's your role as a friend or relative?
Yeah. So, I mean, it's very common. Even when people want to seek help, they still have this lingering ambivalence, right? So people don't turn up in treatment and say, I've made up my mind, I want to give up drinking. And that's that. There's nothing good about drinking for me. Because if they did think that, they probably would be able to do a lot without any help at all. So that's why motivational interviewing is so important. Because it's about coaxing out, getting people to see in black and white, well, these are the pros and these are the cons, and being able to see that the cons actually outweigh the pros, and I just want to stop now. I want to change my behavior. So many people, even when people have decided to make a change, they're ambivalent and they'll benefit from motivational interviewing. What I would say to someone who's worried about friends and family is there are a number of online things you can do which kind of let you count how much you're drinking. And one of the first things you can do is you can just, so things like, there's a website called Down Your Drink, and if you just go to the Alcohol Concern website, basically if you just try and sit down with someone and get them to think about how much they're drinking, then that can be a real eye-opener if people realise quite how much they're drinking. Now, people are probably aware they're drinking more than the government guidelines, but when they actually sit down and look at how much they're drinking, and really it's the way that motivational interviewing would work is it would say, right, well, do you like spending time with your kids? So, as an example, and people might say, well, yes, but I can't take my son to football on Saturday mornings because I'm always too hungover. So the way that motivational interviewing might work is, well, would you like to take your son to football on Saturday morning? And the answer might be, well, yes. So it's about highlighting what you could gain if you stop drinking. And it could well be that giving people a push towards kind of just thinking about how much they're drinking, and then kind of highlighting an aspect of their life that could be better if they stopped, might be enough for them to go and seek help. And then if you can get them to do that, going to see their GP is often the first thing to do, and the GP will just do a simple assessment and then might refer you on, and then you get a more detailed assessment. But simply just getting people to use some kind of online tool and just count how much they're drinking, and then kind of drawing their attention to not why drinking is bad, but why not drinking could be good.
Right.
Could be kind of, do you see what I mean? Do you see the difference? So highlighting what's good, could be good about not drinking. And if you can't think of anything that could be good about not drinking, then, well, it's going to be hard to persuade them.
Yes. Right, Matt, that's perfect. Have you got another 5 minutes for me to run my quick fire questions past you?
Sure.
Have you listened to any of the other episodes?
I have no chance, no.
Oh, that's good. I always like the answers to be spontaneous anyway. Right, before we jump into those though, quick one. Do you have any book recommendations on this topic for people?
Yeah, I'd recommend some books by Mark Lewis, Lewis, who's written the most recent one's called The Biology of Desire: Why Addiction is Not a Disease. I think it's called that. It's called The Biology of Desire. That's very good. And I'm trying to think of good kind of pop science books on addiction. I mean, that's really a nice pop science. Despite the title, that kind of suggests it's very anti-reductionist. Actually, it's not. It's a very good summary of the brain changes that occur. So I would highly recommend that.
Yeah. Some of the best self-help manuals out there have got terrible titles, like David Byrne's Feeling Good is a terrible one. Tony Robbins' Awaken the Giant Within, that's another terrible, but amazing books. Books.
I've not read either of those. But anyway, I'd recommend those. And I'd recommend his books definitely as a kind of nice, accessible overview of what happens in the brain in addiction, and also why the way that we think about it as a disease or not might be important.
Right. Okay. If you could take the reins of power at the Department of Health, what policy or policies would you implement to improve the mental well-being of the general public? And think very dictatorial. You can do whatever you want.
Minimum unit pricing.
So go on.
Well, have you heard of this? This is the idea that cheap alcohol is a particular problem. So if we impose a minimum unit price, so you can't buy alcohol for less than say 50 pence a unit.
Right.
So this would basically make things like really cheap white cider, really cheap vodka. It would make those things very expensive. But basically, the thing you can do to reduce alcohol-related harm, there's pretty clear evidence that this would be effective. Would be to actually raise the basically. You're not raising the price of alcohol across the board, you're just raising the price of a unit of alcohol. So this means very cheap alcohol just disappears.
Right. So just out of interest, has there been a correlation between the cheapening of alcohol and the heightening of alcohol addiction?
Massively. So the relative affordability of alcohol is much more affordable now, and it's since about the mid-70s, and it's just been an ever-increasing. So it's got more affordable year on year since the 1970s. That is almost perfectly correlated with the rise in alcohol attributable disease.
Is that idea kind of gaining any traction anywhere?
Yeah. No, there is. But the problem is any attempt to implement minimum unit pricing is heavily resisted by the alcohol industry, which is very powerful in UK.
Right. Okay.
It's affecting the bottom line. So, yeah.
Oh, I'll definitely be including something to do with that in the show notes.
Yeah.
Okay. What keeps you up at night?
What keeps me up at night? Nothing. I sleep very well, and then my child wakes me up at 6 a.m.
Yeah. How old?
2.
Really 2. Oh, yes.
Yeah.
Fun times though at 2. Outside of family and academia, what investment of time or money has brought you the most joy or fulfillment? Outside of academia and family? Yeah, because they're the two defaults, aren't they? Everyone reverts to that. So outside of those two.
Travel or cycling?
Yeah?
Or both?
Okay, yeah, well, that's it. Do both at the same time. Finally, this would be the big one. What do you think is the key to happiness? Everything in moderation. Oh, I like that one. And it's a nice pithy little quote as well. All right, that's perfect, Matt. All right. Have you got any links that you'd like to recommend to the listeners? Are you on social media?
Yeah, I'm on Twitter. Find me on there, I'm sure.
What's your Twitter handle?
Field_Matt.
Yep.
And I think I'd recommend the Down Your Drink website. That's good. Alcohol Concerns also a good source of information, and kind of if people are thinking they're drinking too much, that's a good site. And also the NHS. If you go to the NHS pages on alcohol, they're a good, reliable source of information.
All right, great. I'll make sure I include all those in the show notes.
Yeah. Oh, one other thing, there's films about alcoholism. I really like Flight with Denzel Washington.
Oh, I've not seen that. I love Denzel as well.
An alcoholic airline pilot. But it's a really good film, I think. Really good, quite sympathetic portrayal of someone with an alcohol problem. And it's quite recent, so I'd recommend. Yeah,
well, I'm always interested in any kind of, because media are really bad at a lot of this sort of stuff. So if there's any media depictions of any kind of mental health issue that people feel, that like academics feel are accurate, I always like to point people in that direction.
So Flight with Denzel Washington is a really good film about a guy. It's about alcoholism, really.
Yeah.
Very good.
Okay, perfect. All right, Matt Field, thank you very much.
Thank you. Bye-bye.
Okay, if you'd like to comment on this episode, you can do so by going to myownworstenemy.org/podcast. That's also where you'll find all the show notes and links to any relevant information. If you'd like to support this podcast, you can do so by leaving us a positive review on iTunes, or just sharing your favourite episode with your friends and family on social media. If you'd like to contact me, I'm Danny D. Whitaker on Facebook and Twitter. Or you can send me an email to danny@myownworstenemy.org. And until next time, behave yourselves, but not too much. And I'll see you again next time.